Okay, this is the opportunity for the people in the audience to ask questions of members of the panel. The microphones are in the middle. If you have a question, would you do me a favor and please state your name first? And then if you have a question for a specific panelist, direct it towards them, or if it's for the entire panel, just state that as well. Okay. Dr. May, I have a question then, since I believe no one else does.
I think that would be excellent.
What can the people do to actually help facilitate some sort of change or further discussion in Washington?
Well, it comes down to the people. As Thomas Jefferson said, once things get so far out of line that the people recognize what's going on, the people are going to put it back in order and put it to rights. And that's our job, to call our elected officials, call the White House, call the Vice President, hold your nose and call Nancy Pelosi. Call all your elected officials, and I'm serious about that. Some might not want to hear from you. Most of them will. Call up somebody when they do something right. Let them know. Too often we really don't let our elected officials know when they do something right. And they need to hear. These people aren't made out of iron or steel. They need uplifting every day, just as every one of us does. Get out there and talk to people. Talk to people who don't understand what's going on, who are concerned about their health care, and most of all, get out there and talk with the young people. These young people have been brainwashed to some degree by our school system, and they really don't know what's going on. And we just need to get out there and talk with them and explain to them that we've got a great country, that we have a good country, that we take care of people not only here in the United States of America. And as Dr. Bessler mentioned, he never encountered a patient once that he couldn't get taken care of, and neither have I. And I'm going to add to that, in 30 years of practice, I never encountered one patient who couldn't afford their medicine that I was not able to pick up the telephone and call and get free medications for that patient for as long as they needed that care. We had a drug that we used for age-related macular degeneration. It cost $1,400 a dose. And more than a dozen times I picked up the phone, the company authorized, I took a box off the shelf, used it, and 3 or 4 days later by FedEx Ground or another service, I had a replacement. So get out there, spread the word, educate the people, and let the people in Washington and in Austin or here in Lubbock, when they do something right, let them know that they've done something right, and let them know that you appreciate it.
Thank you, Dr. May. Do we have a question back here? Yes.
Two-part question. First one to Dr. Scioli. Am I going to have to give up my chicken fried steak?
You get one a month.
One a month. Joe Scarborough from here in Lubbock, and I remember what it was like growing up as a child in West Texas. And I have served my country. My question is to any on the panel, how do we get NATO, I'm sorry, not NATO, that other organization up there out of our business, the United Nations, and how do we turn control of the decisions we make on what we eat, whether we smoke or not, whether we wear a seatbelt, all of it. How do we get the control back into the Americans' hands?
Well, you know, I'm not a politician, and you know, you can blow smoke up here and say things that are not based in fact. So that serves no one any purpose. It is interesting that some people, because of a UN resolution that our government has not yet signed, 1996, said that health care is a universal right. And so people can misinterpret what that really means. The United Nations, and nobody there, to my understanding, had anything to do with writing our Constitution. And they, so, I mean, you know, this isn't going to go much farther than that for me, because I'm not educated enough to tell you beyond what I just said that those are factual things that I said. But you're right. This sense that we are all one resonates, but it should resonate to the extent that we are all one as a country first, and not a world first.
Right.
And if we take care of us like we should, the rest of the world benefits from that behavior model. That's how simple it is for me. I may be crazy.
Thank you, Dr. Cioli. Do we have another question?
In New York City, they're having a terrible time because all of these people from the United Nations don't pay their fines and don't pay any taxes, and it's really causing an expense to the city, according to Mayor Woodward. I wanted to first of all say that I think it might be very important for us to find out who these moderate, who the Democrats are, and write them essentially. I feel like right now, our nation is in their hands.
Right. I think that there's a list out there of the Blue Dog Democrats, and, I'm sorry? Yes, they're right there. Now, it's interesting that you bring that up. We're pretty blessed out here in West Texas with who represents us. You can make a phone call to a congressman and a senator in another state, and they got to take your call. So don't be shy. That was one of the reasons I decided to write that letter. Senator David Boren, at the time, was a Blue Dog Democrat. And the Blue Dog Democrats were the ones that brought down this mess in '94 with Hillary Care. Now, I submit to you that it doesn't matter if you're Republican or Democrat. What we need to do is to have decent dialogue with people with a sense of common decency and common sense. It doesn't matter. David Boren's son, Dan, is a Blue Dog Democrat in the House of Representatives. And I can bet your bottom dollar that I sent that letter to his dad, to David Boren, at every office he had in the state of Oklahoma, and including Washington, D.C. Because I want them to understand the power and the ability that they're going to have to steer how this goes for us. So when I urge you to be active, be active. And you don't necessarily have to be just active with our representatives out here. The list is out front.
Thank you. I am Dr. Heidi Charlotte Horsley, MD, and my husband is just here. He's a Vietnam veteran. He's disabled. And 3 months ago, he was being trapped with something. He felt a terrible cough in his right shoulder. According to Dr. Nathan Wilson, he has a rotator cuff tear. He cannot lift his arm over about 30 degrees. And there is nothing under God's scroll that we've been able to do to get him proper treatment in a surgical consult from the VA system. He's only, like I said, a dental practitioner and I'll be twice a year. We took him to the emergency room in Amarillo. The emergency doctor immediately saw his shoulder, tried to get an MRI, and made an appointment for him to see the orthopedist today. They called early this morning because the orthopedist refused to see him. And he spent the whole day trying to fix that. So this is the kind of thing I'm afraid we could all look forward to if we had complete control of our medical system and 1/17 of our economy, 70% of our economy in the hands of the government. Just as not.
Thank you.